COVID case numbers may be dropping, but the pandemic has taken a heavy, sometimes hidden toll on healthcare workers. We found a dramatic example of that at a Georgia hospital. Here's CBS's Elise Preston.
Every day I read about reports in which my staff are either verbally or physically abused.
It's a far cry from the days when healthcare workers were hailed as heroes. At Piedmont Henry Hospital, south of Atlanta, that's all changed, says Dr. Lily Henson.
We've ensured that we have public safety officers throughout the hospital.
Does it anger you that this is happening to your staff members?
Absolutely. My staff are my family. And the idea that they're not appreciated for the great work that they're doing really breaks my heart.
Just 47% of Henry County residents are fully vaccinated. 64% are fully vaccinated nationwide.
There's a widespread perception in our community that COVID is a hoax.
Healthcare workers here say with each COVID wave, there's a flood of aggression.
It's a difficult situation diplomatically and tactfully to try to get someone to calm down.
It's not uncommon to have a very emotionally tense conversation with families.
What do those verbal attacks look like?
Accusations why we aren't given certain medications that they may have researched on the internet.
How has social media and the spread of misinformation about COVID played into everything that you're going through? You're laughing.
Yeah, it's a sad laugh. You know, social media is a blessing and it's a curse. Day in and day out, they ask for these therapies that have not been shown to be effective.
Dr. Henson says when hospitals are full of patients that don't trust science, it's a dagger to morale.
We get this threat that says, you know, if my loved one dies, it's your fault. That's really heartbreaking.
What about people who have large followings who are promoting the spread of misinformation? What would you say to them?
I would say that they have on their conscience the lives of these patients.
Elise Preston, CBS News, Stockbridge, Georgia.